Jammu is Dr. Jitendra Singh, Minister of State in the Prime Minister's office. Dr. Jitendra Singh, this momentum of 82 lakh vaccinations in a single day, how was this achieved, and sir, can this be sustained?
It's a matter of pride for every Indian. And in fact, I had been saying this right from the beginning, from day one, when Prime Minister initially for the first time launched the vaccination in this country. Many of us have not noted the fact that on the very first day, there were 6 crore vaccinations in India. And that number is more than the number of the total population of many of the European countries like UK, Switzerland, etc. And we have maintained that pace, and I have been reiterating time and again that India is having the fastest pace vaccination drive in the world. Unfortunately, some of the skeptics, some of the critics, they tend to, analyze in a reverse manner by calculating percentage, and they don't know that we have already vaccinated nearly 30 crore people.
But sir, that number also went down in between 2 to 12 lakhs and 15 lakhs. But what is your target? Can you reach and then sustain 1 crore jabs a day to vaccinate all Indians by the year end?
No, yes, we are heading for that actually. As I said, even on day one, nobody was ready to believe that we were actually embarking on a very, very, very massive scale vaccination drive, both in the terms of pace as well as the number of inoculations being done each day. But I think the fact is proven from time to time. And some of those hotspot regions, which were seen with a great degree of skepticism. Now, since I am also looking after, I was also responsible for monitoring the COVID in Northeast and the districts of Jammu and Kashmir, Ladakh. We found that the hotspot district of Bandipora was the first in the country to report with a village which had gone through 100% vaccination way back, about 3 weeks back, 4 weeks back. And I think we have maintained that pace.
Maintain and then improve, because doctors fear the third wave, by some accounts, may just be a couple of months away. And at this pace, now, can we arrest the third wave in case we move forward, the country moves forward at this pace of vaccination, sir?
The basic susceptibility of COVID rests on 2 fundamental factors. A, the immunity status of the individual. B, the amount of exposure to the viral load. And therefore, certainly vaccination would help boosting, reinforcing the immunity status of the individual. And therefore, even though it may not provide 100% shield against a person getting infected with corona, but certainly we have statistics, we have evidence to prove that the morbidity is lesser, mortality is certainly very low. There are studies to indicate that the requirement for oxygen may be as less as just about 8% of the persons who have got COVID after vaccination, and the death rate may be almost negligible. So certainly it becomes imperative for every one of us, and the herd immunity also is related to this. So it becomes imperative for each one of us to get ourselves vaccinated, not only for our protection, but also for the protection of our dear ones and the protection of the society at large. And I'm sure even after the vaccination has been accomplished in toto, the basic guidelines of maintaining the physical distancing, avoiding crowds, etc., would have to be followed very religiously, very strictly, so that we do not incur into another kind of a wave or whatever, as is being said. And not only that, it also protects us from a number of other droplet infections.
Sure, but is vaccine hesitancy is still an issue? You were talking about Bandipora in Jammu and Kashmir or Northeast, which again is a part of your area of responsibility. Is vaccine hesitancy still an issue in parts of our country, sir?
No, I'm glad you asked me that question, Gaurav, because I think through you also like to share with countrymen across India. The initial hesitancy, if at all was there, has been seen to get vanished in a very evidential, very evidently. Now, for example, I was citing to you the example of
Bandipora.
Kashmir Valley,
Yes.
where maybe perhaps for whatever reasons there was some hesitancy. Now we have people in the last 1 month. Of course, now the vaccine is available in sufficient quantity. They were asking for vaccine being available. There were queues of people lining up to get themselves vaccinated. And this village in Bandipora, as I said, is the one which was the hot spot in the last wave. It also had some degree of hesitancy, the community hesitancy, as far as the vaccination is concerned. But this was the village which came out to be the first in India to have registered 100% vaccination. So this is not only a huge departure from the earlier myths and misgivings, but it's also a very loud message for the compatriots across the country. And I'm sure that the scientific logic of it has been realized even by the. Now, interestingly, even some of our opposition leaders who are questioning the efficacy or authenticity of vaccine are secretly going and getting themselves vaccinated. So I think I need not name them, but I think that is the amount of realization that has dawned across the country.
Okay. So you're saying vaccine hesitancy is going away, but what about bottlenecks in supply chain? Now, can the government maintain this pace or improve this pace in the weeks and months ahead so that we don't see the kind of shortages or long queues that we did in the past, which some argue was perhaps poor coordination between the centre and the states, Minister?
I'm sure. You see, I think the biggest asset for us is Prime Minister Narendra Modi. Right from the beginning, the preemptive decisions taken by him, preemptive steps taken by him, visionary suggestions and inputs offered by him have helped us not only to control COVID in spite of the constraints of a huge population and a heterogeneous character of society. It has also enabled us to launch a massive vaccination drive, which is now being cited as a role model for the rest of the world. Now, as far as the supply chains are concerned, can we just realize that the first task force for vaccination was constituted somewhere in the month of April last year, and within a period of 1 year, we have 2 vaccines already there, Sputnik coming in. The Serum Institute and the biotech have increased their manufacturing of vaccine numbers to many-fold, and I'm sure in the next 2 weeks we will have sufficient number of vaccine availability up to the district level. And I have in the last few days, because virtually every day I'm going to one or the other vaccination center, sometimes in my own constituency, sometimes in other parts of Jammu and Kashmir. I've visited vaccination centers in Guwahati, elsewhere, and New Delhi, of course, when I'm here. Some of the vaccination centers do not have much of the waiting period now.
But what about vaccines for children? When does our country move forward so that after 18 plus, we are also able to save those who are below the age of 18, sir?
Yes, certainly. And the scientific headway is already being made on the various techniques or methodologies of making it more convenient for the youngsters, for the children, making it more friendly and making it more hospitable. So I think we are actually heading in the right direction, and sooner than later we would actually emerge as a kind of reference model for the rest of the nations of the world.
Okay. Dr. Jitendra Singh, for the moment, many thanks for joining me here on India First.